If you feel a fever coming on today, you can drive to the nearest pharmacy and swallow a synthetic pill designed in a modern laboratory. You expect immediate relief. For 99.9% of human history, that option did not exist. There were no clinics, no sterile antibiotics, and no emergency rooms. When someone fell ill in ancient Egypt 3,500 years ago, the experience was viewed as a spiritual invasion. Disease was perceived as an invisible enemy, a wandering demon, or a divine punishment that had forced its way into the body. But the Egyptian response went beyond ritual. Their physicians, known as swanu, categorized ailments as natural injuries, infections, or spiritual afflictions, applying a range of specific botanical treatments for each. It is 1500 BCE, during the height of the New Kingdom. You live in a mud brick house near the banks of the Nile. The river provides your water and food, but it also hides biological threats. Every year, the floodwaters carry schistosomes, parasites that cause chronic infections across nearly the entire population. You wake up with a burning fever and body aches. Your throat feels like it is coated in shards of glass. Without a hospital to go to, your family summons a local healer or a temple physician to your bedside. In this world, illness is a communal crisis. Treatment happens in the center of the household, where the family gathers to assist the physician. The physician begins by checking pulse, examining your skin, and listening to your breathing. They are looking for physical symptoms, but also for signs of a spiritual imbalance. At this time, doctors were already diagnosing complex internal conditions without modern imaging or the formal human dissection later used in Greece. Their knowledge came from an unlikely source: mummification. Because they regularly preserved the dead, Egyptian embalmers developed a unique visual map of the human body. By physically extracting organs, they learned where major blood vessels operated and how specific injuries impacted internal systems. This cultural proximity to the dead provided a biological understanding of the living that few other ancient civilizations possessed. To treat you, the physician uses a dual approach: snu, or rational medicine, combined with heka, which provides spiritual protection through spells. You are wrapped in linen and given a bitter draught containing specific plant extracts. If you have an infection, they apply honey to the area. Honey creates a natural antibacterial seal over wounds and inflamed tissue, preventing further contamination. For digestive issues, they use plant-based extracts that function as natural laxatives and antiparasitics to clear the infection from your system. This method addressed the biological infection, while the accompanying rituals managed the patient's fear, treating both the body and the mind during the crisis. While the Egyptians did not have a theory of germs, they were meticulous observers of clinical outcomes. If a specific plant-based treatment stopped a fever in 3 out of 4 patients, it was recorded as an effective remedy. These observations were collected into massive medical texts, like this papyrus. It served as a centralized database of proven treatments. This allowed medical knowledge to be standardized across the civilization, ensuring that physicians in different regions used the same evidence-based protocols. The Egyptian sickbed functioned as a site of early pharmacology, where treatments were tested by observation and success was measured by the survival of the patient.
Inside your body, right now, a 3,000-year-old defensive reaction is playing out. Your immune system identifies a threat, triggers an inflammatory response, and sends cells to neutralize the invader. Biologically, you are identical to the people who lived along the Nile at the dawn of history. Yet, the way we experience that biology has shifted. When you fall ill today, it is often a solitary experience. You lie in a quiet bedroom, waiting for a fever to break, feeling the sudden, isolating weight of a body you can no longer control. Your first instinct is to reach for your phone. You scan through lists of symptoms and search for a diagnosis, trying to find some form of certainty to manage the anxiety of a failing system. That desperate search for an explanation is exactly what drove ancient Egyptians to consult their medical papyri and temple priests. They weren't just looking for medicine, they were looking for a way to reclaim control over the unpredictable. Our high-tech defenses have changed the outcome of the fight, but they have also changed the environment where that fight happens.
Deep down, despite our modern tools, we still crave the same psychological reassurance that our ancestors sought when their health began to fail. The Edwin Smith Papyrus, dating to 1600 BCE, provides hard evidence that ancient Egyptian medicine was far more than just magical spells. Translated by Egyptologists, this artifact reveals itself as a rigorous trauma surgery textbook, documenting 48 specific surgical cases. The document is structured with systematic anatomical precision. It begins with injuries to the head and proceeds logically downward through the body, case by case. Each case follows a strict scientific protocol, a physical description of the injury, a formal diagnosis, and a final prognosis for recovery. The treatments described are purely physical. The text provides instructions on how to stitch open wounds using nothing but linen thread. It outlines orthopedic practices for managing fractures, using splints to immobilize broken bones and allow them to set correctly. For severe hemorrhaging, it even recommends the application of raw meat to stop life-threatening bleeding. Perhaps most advanced was their commitment to honesty. The papyrus explicitly tells the physician when an injury is untreatable, prioritizing evidence-based reality over false hope. These physicians practiced a science that was acutely aware of its own limits, establishing a foundation for medical methodology long before the modern era. Modern medicine inherited this clinical rigor, but in our drive for efficiency, we have largely stripped away the human context that once surrounded it. Today, our systems treat patients like biological machines. We focus on fixing the mechanism, the cells, the organs, the chemistry, while often ignoring the person inside the machine. This hyper-focus on the biological means the profound social and psychological weight of being ill is frequently treated as an afterthought in our clinics. To the ancient Egyptians, the idea of separating science from the spirituality of the person would have been nonsensical. They viewed healing as a holistic experience. While their manuals were scientific, their practice was communal. A patient wasn't isolated in a sterile ward. They were surrounded by family who offered herbal remedies and quiet words of comfort by the light of an oil lamp, ensuring the treatment involved the entire community. Our modern division between physical science and emotional support is a recent invention, one that has made our care more efficient, but significantly lonelier. We have gained an incredible level of medical power. We have vaccines, antibiotics, and surgical tools that can save lives from conditions that were once a death sentence. There is no villain in this story. No one planned for our healthcare to feel cold or detached as it became more capable. What we are experiencing is a biological mismatch. Our hyper-efficient technological systems simply aren't designed to meet our ancient, hardwired need for human connection when we are in distress. We traded the psychologically comforting rituals of communal healing for the precision of the clinical clinic. We are safer now, but we are often more isolated when we hurt. Yet, there is an unbroken thread connecting you to those people along the Nile. The same human vulnerability is there, and the same loving desire to see a person heal still pulses through our history. Every time your body fights off an infection, you are echoing the survival strategies of a lineage that has been battling disease since the dawn of time. You haven't lost your biological edge. You are a survivor of the ancient human condition, built to endure and built to last, the latest participant in a tradition of healing that stretches back 3,000 years.